Right. Hello. I am Christina Foss. I'm one of the social workers at Stevenson, and I'm just going to wait just a couple minutes to try to admit some people into the room, and then we will get started. Wonderful. Thank you all for your patience. Okay. Well, again, hello. I am one of the social workers at Stevenson. Again, my name is Christina Foss, and I want to welcome you to our family engagement presentation tonight. We have the pleasure of having Dr. Adam Crane join us today. He's one of the licensed clinical psychologists in our community. He's someone who has worked within our local community for a number of years. So not only does he have expertise in this area, but also has been a huge community partner with Stevenson and Stevenson families for a number of years. So we're very pleased and excited to have him join us today and to be able to share with us his expertise on screen use and digital health. So with that, I will turn it over to Dr. Adam Crane. And if I may ask, we will have the chat. So if you have questions, if you could please put them in chat, and we will hold your questions until the end so that we can be able to answer those. So thank you again for spending some time with us here today.
All right. Well, good evening, everybody. Thank you so much for having me. I appreciate the opportunity to talk to you about problematic screen use. There we go. Sorry, I think I was muted. Okay. I'm Dr. Adam Crane. I'm a clinical psychologist, and I've been working in the Buffalo Grove area for the past 20 years. And today we're going to be talking about problematic screen use and digital health. So thank you all very much for being here. So let's go over the objectives. What is it that you can expect to learn tonight? So what I'm hoping to cover is to kind of help better define what is problematic screen use. So this is something that's becoming more and more of a problem as phones have been relatively widespread for quite some time, but it's becoming more and more of an issue regarding all the social media apps, regarding gaming, different things like that. So we want to get a clear definition between what is problematic and what is relatively normal. We also want to talk a little bit about how does problematic screen use impact brain development, a little bit of the neurochemistry, the neurology behind it. What are some of the physical, mental, social factors that come as a result of using too many screens? And along with the brain development, we're going to get a little bit into why screens and phones and so forth can be so addictive, why they can be so relatively dangerous and problematic for your kids. And for you as adults as well. So we'll get a little bit into the science behind that to help understand that. And then that will be the first part of the presentation. The second part of the presentation, we're going to talk a little bit more about strategies. Some general strategies that are going to help your children and your teens limit their screen use, maybe find some better balance in their lives. And we're also going to talk about maybe some strategies to help you as parents to avoid power struggles. Help set some reasonable expectations around screen use. I know a lot of the questions that I get from my clients are, how do you avoid the arguments? How do you avoid the anger that comes when your child is being told to remove themselves from a screen? So there's some strategies and some things that we'll go over that'll hopefully be helpful in that regard. All right, so I kind of would like to start off with, this is just a quote. If anyone's familiar with Ross Greene, he's a psychologist. He wrote the book, The Explosive Child, if anyone's ever read that. It's an older book, but it really holds up. And there's a way that he conceptualizes problems that I think is so simple, but at the same time, it really helps to give you a better guide as far as how you're supposed to help your child. So his quote is, "Your understanding of the problem guides your intervention." So in other words, if you see your child as being disrespectful or being just rude or being obnoxious, maybe you'll treat them that way. Maybe you'll react to them that way. But if you understand the problem with some of the information we're going to provide tonight, it might help you to have a better way to approach what the situation or what the problem is and how to best resolve it. So if you keep anything in mind, keep that in mind as we kind of go through this material. Hopefully some of the things that we talk about will help you to understand a little bit more about screen use and how to best navigate and find balance with your family. All right, so why do you need to be concerned? So some statistics here for you. So as of this year, 91% of people tend to access the internet through their phones. This was only about 20% roughly 15 years ago. So you can see how exponentially it has grown. It's becoming a pretty prevalent, it's a pretty ubiquitous way that people are accessing the internet, and most people have phones, and especially kids are getting phones at younger and younger ages these days. Other statistics are 71% of people never turn their phones off. 31% say they cannot stop using their phones even if they wanted to. So you can already start to see the compulsions building, the difficulties. Think of all the times that maybe you've misplaced your phone in places that you don't have it with you. It's just sort of the anxiety that you feel. Pay attention to that feeling. That's going to be something that we're going to refer back to, which makes it somewhat difficult for your kids or your teens to be able to give their devices up. And this last statistic is one of the things I found to be relatively interesting, and we're going to be discussing this more in depth near the end. But 17.3% of parents tend to spend more time on their phones than with their children. So as you can see, phones aren't really just a problem for our kids, they're a problem for us too. And we want to find better balance for the whole family. So some of the strategies that we will talk about will be for your children. It'll be how to parent your children differently, but it'll also be maybe some things that you walk away from this presentation and you understand a little bit better about how to best monitor your own usage. All right, so when we talk about what's appropriate, what's inappropriate as far as time, I get this question quite a bit. How many hours a day should my kids be on screens? And the American Pediatric Association says usually no more than about 2 hours a day for television, for screens in general. And some of that is a little bit difficult to regulate, considering during the school day, kids are using iPads, they're using laptops to basically get their assignments, to do their material. So we're going to take that into account as we look at some of these hours that are spent on screens. But typically youth aged 8 to 10 years old spend roughly about 6 hours per day on screens. And when you think about how many hours a day they're in school, how many hours of those days they are doing actual assignments on screens, you can see that it becomes excessive. So if your kid's school day is roughly 5 hours, figure maybe about 3 to 4 hours a day are in core curriculum courses. There's an extra 3 hours that they're using for screens. Yes, some of it might be for homework, some of it might be for research and assignments, and that's more of a positive use of technology. But the idea that them just being on screens at all is part of what you want to consider. Youth aged 11 to 14 spend considerably more. They spend about 9 hours per day on screens. And then youth aged 15 to 18 spend about 7.5 hours per day on screens. And as far as the demographics go, problematic screen use is much more prevalent in boys than in girls. But there are some distinctions, girls being more prevalent on social media, boys being more prevalent with internet gaming. But by and large, using phones and computers and video games is more common with boys. All right, so with that background, we have to think about what defines problematic screen use. We need some sort of working definition here. And so this has been part of the Public Health Department's definition of problematic screen use: the inability to control one's use despite private, social, and professional life consequences. So even if people know what damage the phone is doing, being on screens, negative consequences will come as a result of using it, and they still have a hard time controlling it, that's when we're starting to see a shift into more problematic use. The ability to be able to walk away and feel okay about it, that's fine. That's kind of the ultimate goal. I mean, phones are and internet use are things that are very integrated with what we do every day, but the inability to control is the part that we shall be focusing on. And there's different types of problematic screen use. We're going to talk about them kind of all in one lump sum, but when we talk about problematic screen use, we're referring to things like excessive social media consumption, gaming addictions, and just general internet dependence. So when we talk about phones and screens, I'm kind of referring to all three of these things combined. There will be some moments where we talk about them separately, but by and large, screens overall are kind of the issue with some of these separate little pieces. All right, so there are certain elements to problematic screen use, and it's hard to define it as simply just an overview of a difficulty to control oneself. There are some key indicators here that you want to make sure that you're noticing to really tell if your child or your teen, or maybe even yourself, if you have a problem with your screens. And the first one there you can see is salience. So how often are you thinking about your phone? How often are you thinking about screens? How tempting is it for you to always have it present? And the more salient it is, it could be a sign that it's becoming more of an issue if it dominates your thinking. The second component here is mood modification. So if it goes in two ways, either being on your screens modifies your mood, or being off of your screen modifies your mood, then that becomes more of a problem. So being on your screen, if you find that your children are becoming more irritable, if they're becoming more depressed when they're not able to use their phones, if there's more of an anxiety that they don't know what's going on with their friends because they just can't check their Instagram feeds, that's more of a mood modification. If you can see that it makes a difference to that degree, then it's relatively important that you start to have the red flags rising that there might be more of an issue here with the phones. The third key element that we wanted to look at is tolerance. So it's not enough just to be on the phone or be on a screen or a video game for half an hour. There has to be more and more time. And we're going to talk about this in terms of the neurochemistry in a few slides down the line here. But tolerance can be just more of a desire, but tolerance could also be more of an addictive quality. So a need to increase your time on screens refers to just a desire to want to be on the screens more frequently, but it also can refer to that your brain is needing more of a surge of joy, of elation that it will come from being that screens can bring. And along those lines is the next key element, withdrawal. So again, this could just be a sadness or a dissatisfaction that you can't be on your phone longer than you want, or that you have to turn the video game off to go do homework. But if you notice that with your children, with your teenagers, that their mood typically worsens when the screen activity decreases, more anxious, more irritable, just more sullen, these could all be signs put together. The withdrawal is also part of what happens with the brain chemistry as well. So as we talk about this a little bit, this will make more sense, but withdrawal can be done also the same ways as tolerance, part of an addictive cycle. The next key element is conflict, and I'm sure that a lot of people have experienced this already with their children, but screen activity negatively affects your relationships. So either it is you get a lot of power struggles, you get a lot of arguing, you get a lot of fights, a lot of pushback, or you just feel your child is relatively withdrawn, that they don't really talk about much. They're too involved in their phone. They're missing conversations. And it happens at a more regular pace than what you'd like. That's what we mean when we refer to the conflict. And then the last key element that really helps to kind of define what makes problematic screen use problematic is the relapse. So even if after efforts to try to put the phones down, turn the video games off, turn off social media, things are going okay, but the pattern of returning to screen use resumes, and almost in the same intensity and the same frequency. That's when it becomes more of an issue, when that's really the difficulty of just walking away and being okay with being off of the screens and finding something better to go do. So these key elements, if you're seeing any of these, you're going to notice that maybe that this is much more of a problem than what you thought. But this is a way to kind of break it down, just to kind of give you a better sense for how to measure that within your family dynamics. All right, and one of the other people do ask me quite a bit as far as internet gaming disorder. This is going to be it's a term that's getting a little bit more traction, and people ask if that's an actual diagnosable disorder. The answer is, for right now, it is not. What it is, it's a condition that's listed with the American Psychiatric Association's DSM-5-TR. It's their statistical manual for diagnosis. They've labeled it as an area of concern that just needs further research and consideration. So usually whenever they're starting to consider that things are more of a problem, things are needing to be considered diagnoses, they list them first as conditions. They do further research, and it might be several years before something like this does become a condition that's actually diagnosable. But for right now, it's just something that's on the radar of the APA. Within internet gaming disorder, it only considers gaming and not internet use or social media consumption. So there may be some separate subtypes that come down the line, but for right now, they're just looking at the gaming aspect and how that has impact on youth. All right, so screen use can have an impact in a number of ways. I alluded to before that one of our goals is what is going to be the impact. And we talked about maybe from a neurochemical standpoint, but there's also impact on physical health. And so when we talk about physical health and screens, what we're finding is there are higher levels of obesity. As a result of the obesity, there's cardiovascular problems that develop, including high blood pressure, diabetes, and insulin resistance. We're also finding that kids and teens are getting much worse sleep, more disruptive sleep, and fewer hours in total, and also problems with impaired vision. So it makes sense in a way that if you're using screens more often, you're not as active. You're also susceptible to poor eating choices. There's more mindless snacking. There's poor health choices, food choices. So obesity is the result for a lot of these kids. Some of the other physical issues that do result from chronic screen use: increases in muscle weakness, increases in neck pain, decreased hand strength, and increases in, we're seeing more carpal tunnel problems with youth. So, which makes sense if you're holding a phone and your hand is constantly in the same position, it would make sense that there'd be more increases in muscle weakness and hand problems. I read recently with neck pain, there's actually more injuries and neck strain that doctors have found in people in their 60s that's coming up more regularly with people in their 20s. As a result, if you hold your phone at your chest level or at your waist level and you're constantly looking down at it, it's putting undue strain on your neck and it's creating those kinds of problems. All right, so we talked about sleep difficulties. Let me just show you a little bit. Some people don't always understand what happens with using phones at night. I know it's a common practice to ask your kids to put their phones away, or it's a good idea to have them to not use their phones at night, but especially right before bed. And the reason for that is that if you use your phone at night, the blue light that comes off of the phone, what it does is actually it suppresses the production of melatonin. It's in the pineal gland, as you can see from the chart. Once the pineal gland cannot produce melatonin, you can't regulate your sleep cycle. So melatonin is the hormone that helps regulate sleep, helps give you regular, consistent sleep throughout the night. It helps make sleep so it's not so disruptive. So as a result of using phones late at night, we're finding that kids and teens are actually having a harder time staying asleep. They're having a hard time sleeping consistently throughout the night. And just because in trying to sneak their phones or even using their phones too often, they're pushing their bedtimes back. So they're not as awake or alert for school or for just whatever they have going on the next day. So that's why it's a good idea to give it at least probably a good solid hour before you go to bed to have the phone put away. All right, so impact on mental health. With more problematic screen use, chronic hours of the day being devoted to screens, what we're finding through the research is there are higher levels of depression and anxiety, more higher levels of internalizing and externalizing behaviors. And what that means is internalizing behaviors is more self-esteem issues, self-doubt, body image concerns, things of that nature. Externalizing behaviors are more acting out, so more aggression, more argumentativeness, even like social isolation, different things where it causes more of a behavioral issue. We're seeing more of that. Lowered self-esteem as a result of using more of the social media apps. And along with that, our feelings of inadequacy and social isolation. And we'll talk a little bit more about that in a bit. But as far as the impact goes, yeah, the more that, ironically, the more that kids are seeing or using their phones to connect socially, it's actually driving them further apart. There's more of a sense of inadequacy. There's more of a sense of other people are doing better things. And as a result, they're finding that they isolate a little bit more. It's a little bit hard for them to feel that it's okay to be more socially involved, and especially if they're feeling they're being left out of things. There was one particular site I wanted to mention here. In teenagers in particular, teenagers on screens that spend more than 5 hours per day on their screens, 71% of those showed at least one risk factor for a major depressive episode. And this does include suicidal ideation. And this was compared to a control group of adolescents who have been on screens for less than 1 hour per day. So there's a lot more evidence that's coming out that's showing the longer that kids and teens are on their phones, the higher their risk for mental health issues are, for depression, for anxiety, and even for self-harm. So that's why it's so important, so crucial that we have ways that we monitor this better and ways that we can better control for their usage. Some other impact on mental health, just to give you guys some other studies here. In 2014, there was a study that found a correlation. This is one in particular for social media, between high social media usage and depression and anxiety. And the results showed that teenagers compared themselves unfavorably with peers, which perpetuated, as I was saying before, a sense of isolation and loneliness. And what we're seeing is that this is especially true for girls. There was a follow-up study done in 2016 where 1 in 5 girls reported major depressive episodes from social media use. And I'm sure a lot of people have heard the term FOMO, fear of missing out, that certainly being on social media can perpetuate because you can see what everybody is up to. But there's something that girls experience more is called FOBLO, which is the fear of being left out. It's not even just missing out. There's almost like a deliberate sense of being bullied or being excluded, and being witness to that based on what they see with their friends doing through social media channels. And this is much more frequently seen with girls than it is with boys. So you can see the incredible rise over the years of depression and anxiety with teens and with youth. And a lot of it is just their awareness of what's going on around them through the internet, through social media. And then just a little bit further, as far as social development, I was talking about this just a moment ago, but constant distraction from phones may also lead to social impediments. So I was saying the more time on your phone means less time being in actual social situations. You know, the irony I was talking about earlier, that it's devices are meant to be more socially connecting, and in some ways they can be, but they're also showing that they isolate much more frequently than they connect. And I think with the pandemic, there was quite a bit that went on as far as kids being on screens. It became more comfortable, became more familiar. And as we came out of the pandemic, I was seeing, at least in my practice, quite a bit more anxiety about how to reconnect with their friends, how to be more social, how to enjoy activities that are more mutually supportive versus just having it easier to be on devices and just connect remotely. Having a phone with you does increase your exposure or temptation for comparison and tends to bleed into many aspects of your life. So it's not even just being on the phone, but when you're not on your phone, the pressure to check your phone, to check screens more often results in higher rates of what we were saying before, that FOMO. And I was saying that 31% or so of people have a hard time turning their phones off at all. It's actually been shown that 45% of adolescents report that they are online constantly. So you can start to see the buildup here. There's a lot of feeding into needing to be on their phone, needing to see what's going on all the time. And as we get into the neurochemistry of it all, we'll understand a little bit more about why that is and what happens, what causes them to want to have to be on their phone constantly, or just on social media constantly. And then on a cognitive level, there are impacts that screens have. We were saying before that schools do use screens at a more regular rate for homework and assignments and research, and which could be positive. But regular exposure to screens can also overwhelm the brain and your thinking. So extensive use of phones, several hours at a time, has been shown to lower your attention and concentration. It also increases the tendencies towards distraction and multitasking. So how many times have you found that you've got your phone out and you're having a conversation and you get a text message or the phone buzzes, a notification of some kind, and you're drawn to it? So you're not really as focused or as concentrated as you need to be with that conversation. So phones, even just the presence of them, it's not just being on them. Even if you just have it on the table, if you're at a restaurant and you're just constantly looking to see when the next notification is coming, your attention is pulled from what probably needs to be focused on. So just the very presence of a phone can actually do quite a bit to lower your ability to be cognitively aware. What studies have shown is also that being on phones, being on screens with the lowered attention and concentration, it actually leads to decreased creativity and actually lowers self-confidence. There's too much comparisons. There's too many things that people look at, and it's the phone takes over and the screens take over, and it's too easy to just follow the lead of what you're being shown versus what you think of on your own. And just regarding cognitive functioning, with regard to multitasking, we're really only able to focus on maybe one or two items or tasks at a time. So when we introduce things like screens, and we're doing homework, and we're trying to study for a test, that's too many things going on at once. You can see where you're not going to be able to retain very much. And the thing I'll say about attention is the challenge with attention is that if you aren't able to pay attention, if you're not able to maintain concentration, what that translates to is you're not able to convert short-term or immediate memory into short-term memory into long-term memory. So we don't remember as much. So, for example, if you're going to study for an exam and you're too busy being distracted by too many things in the room or what's in front of you on your screen, you're likely not going to be able to commit that to memory, that information, to be able to do well in your academic performance. And this goes for as well for adults with work performance too. All right, so why are phones and screens so addictive? So let's get into the neurology of this a little bit, and the neurochemistry. I want you guys, this is part of where that Ross Greene quote, your understanding of the problem guides your intervention. Now that you have a little bit of that background, now you have a sense here, we'll talk about it. You'll hopefully develop a sense about what it is about your brain chemistry and how dependency evolves to make it difficult for you to give up your screens. So in doing that, first, let's define addiction. Just because what we're talking about, there is a very close similarity. So the definition for addiction is that it's a neuropsychological disorder, and it's characterized by a persistent and intense urge to use a drug or to engage in a behavior that produces natural reward despite substantial harm and other negative consequences. So if you remember before, we were talking about problematic screen use, is that difficulty giving up your screens, even though you know what the consequences may be. So this one is a little different in that producing a natural reward is where the addiction kicks in. And we're going to talk about what that means exactly in the brain. So when you have something that produces a natural reward, and it's hard to give up because it's something that we're just naturally drawn to. We're drawn to want to see the feelings of joy and elation, but we don't realize is how badly these things might be actually hurting us. All right, so let's talk about that. So we're talking about reward-seeking systems and pathways in the brain. And this is what we see most often with addictive behaviors, but this is something that happens naturally. It's not a problem when it's just in its regular course, but there's two things to consider: dopamine and the neural pathways. And for those who aren't familiar, what dopamine is, it is a neurotransmitter, and it is a chemical in the brain that it regulates motivation, and it regulates the desire for rewards in the brain. It's kind of the drive. It's kind of the, once there's more dopamine present, we have more of an urgency, more of a sense of pressure to want to achieve a reward. So reward-seeking behaviors like screens, drugs, alcohol, those are reward-seeking because the reward itself is the joy. It's the elation that comes from use. And screen use certainly is one of the things that causes a surge in dopamine. Now, the dopamine operates according to these neural pathways. By themselves, they probably don't mean much, and I'm just giving this as background. But there's three types that are in operation here. There's the mesocortical, which impacts things like cognition, memory, attention, emotional behavior, and learning. There's the nigrostriatal, which regulates movement and sensory stimuli. And then there's also the mesolimbic, which stimulates and drives pleasure, reward-seeking behaviors, addictions, emotions, and perceptions. So the three of those working together, along with dopamine going through their pathways, is what contributes most of the neurochemistry that we're referring to here with more addictive screen use. So let me show you a diagram of kind of what this all looks like. So you can see here the mesocortical pathways here is in teal, the nigrostriatal is here in green, and the mesolimbic is here in red. And dopamine travels all along these pathways, and it enters this little purple dot here. This is called the nucleus accumbens. And what that is, if more common terms, is the pleasure center. So if you ever heard about dopamine hitting the pleasure center and there's a surge in joy, it's actually hitting the nucleus accumbens. So that's where that is located in the brain, and that's what causes us to feel the joy that we do out of a particular use. All right, so how do these all work together? What is it that they do that contributes to the problems that we're talking about here? So as I was saying, when there's a constant stimulus that's introduced or even anticipated, it doesn't even have to be that you're on your device. It could be just you're excited about using your device. Dopamine gets released through these three pathways, and it activates that nucleus accumbens, the pleasure center. Feelings of positivity and elation result, and then the system kind of is in gear. So the stimulus, as I was saying, it could be anything with regarding to social media notifications. Even if you get likes and follows, you get pings, levels of gaming achievements, incoming text messages. All those things serve as alarm bells for the brain to get excited and to start to release dopamine. So when does the addiction part happen? So like I said, this is a relatively normal part of the brain function, but all is well until the stimulus disappears or diminishes in frequency. So if you're not on your phone as much, you're not getting those pings, you're not getting those text message alerts, you're not getting the joy that comes from the gaming. Once this happens, once you're done with those levels, once you're done using your device, your brain starts to feel a little bit of stress or anxiety about when the next hit or the next wave will take place. It was such a joyful experience, that kind of looking for the next time it's going to take place and when it's going to happen. So on small levels, there's stress, there's anxiety about it. And what it does is it drives us to want to keep using our devices or using substances. This applies to all sorts of addictions. And because we want the next hit or next wave. I'll describe this term here, delay discounting. So in seeking these rewards, delay discounting is that the value of a reward goes down the longer that you have to wait for it. So it's not enough that you want to have to wait until the weekend to start using your device again. Won't be as special, won't be as meaningful. So you want to use it as quickly as possible to get that positive elation back again, that surge of dopamine. So what it does, delay discounting, it leads to seeking more and more intensive rewards much more quickly. And you can start to see the buildup here about why it's so difficult to put something that gives you this sort of pleasure, why it's so hard to put it down. So the more the delay discounting, something else takes place called long-term potentiation. I know I'm throwing a lot of terms at you guys, but hopefully you're keeping up with this. The problem with long-term potentiation. So what is that? It's the process that strengthens the pathways through reinforcement. In other words, the more you do something, the more it becomes habit forming. The more that you seek these kinds of pleasure stimuli through phone use, through video games, through social media usage, pings, the likes, all the above. The quicker you do it, the more often you do it, long-term potentiation is the result. This makes it incredibly more difficult to reclaim a sense of normal. All you do is look forward to that time that you're going to start to feel good again. And when you're not using your device, when you're not using a screen, it tends to lead to feelings of sadness and malaise with just regular life. You can't find the joy or the satisfaction that normally comes with just everyday activities. So as a result, you want to continue to game or just use your phones and scroll social media produces better results for you. So hopefully putting all those together, it makes sense as far as why it becomes more and more difficult, especially when the brain chemistry itself kicks in and reinforces these bad behaviors that makes it difficult to give up. It becomes more of the addictive behaviors that makes it very challenging. The one I'll say, there was also with long-term potentiation, to go along with that feeling of sadness and malaise and just kind of regular everyday life, there was a study that was done in 2021, so just a couple of years ago here, where they found that 7 hours or more of screen use led to someone being twice as likely to develop symptoms of depression. So the more that you get used to using your devices, the more you get used to social media presence, screen use in general, when you're taken off of it, your depression goes through the roof. So that's why it's a way that people who use too often and too frequently feel that they need to use more of it to feel happier. It's really a false narrative. What it does is actually perpetuates those feelings of depression. So here's a cycle of dopamine, just more in a bit of a graph form. There's a perceived, the high motivation comes from a perceived reward opportunity. You think there's gonna be something good that comes from using your phone. You get a little bit anxious, a little bit restless that you don't have it yet, so you're driven to want to get it. Once you get that reward, you no longer feel anxious or restless, you get the pleasure out of it. Your motivation is lower. But once you're able to kind of, this cycle perpetuates, there's another, just to complicate it a little bit further, there's another hormone called cortisol, which is released in the brain when you're under stress. And I'll tell you what cortisol does is basically helps regulate the body during stress. So if you're in intense periods of stress, the body and the brain basically shut down all unnecessary functions, not completely, but enough to focus on the stressful event. So the brain's priority is to reduce the stress level that comes from not having screens. So cortisol is its way of trying to regain that. But high cortisol levels have been shown to be a problem with things like weight loss difficulties, sleep difficulties, all sorts of things. But in particular with screens, this is where some of it comes about. One other thing I'll throw in here, the surge of dopamine release can be so powerful that the reward-seeking outcome, and this is more on a structural part of the brain, can also overpower or shut down the prefrontal cortex of the brain. So just when you thought it wasn't going to get more complicated, here it goes. Then anybody's saying, well, what is the prefrontal cortex? What does it do? Hopefully you can see the picture in the corner there, but the part that's in yellow is the prefrontal cortex. That's part of the frontal lobe. And it affects a variety of complex behaviors. We use it for judgment, we use it for planning, we use it for suppressing negative emotions, impulse control, personal and social decision-making, as well as goal setting. Prefrontal cortex also helps us to weigh risks and rewards. And this includes the ability to stop pursuing immediate rewards like gaming in favor of better long-term needs. So a recent study shows that not only is dopamine causing the prefrontal cortex with prolonged exposure to shut down, a recent study done in 2018 shows that for gaming for 7 hours a day or more, the prefrontal cortex actually thins. So what that means is that you're not as able to use good judgment. You're not as able to plan well, to suppress your negative emotions, and you can be more erratic or more impulsive. Your decision-making is out the door, and you're not able to weigh risks and rewards. If your teen or your kids aren't able to see that what they're doing is bad for them, it might be because their brain structure isn't really allowing them to. Excessive game use, it impairs their judgment. They can't see that there's a better thing for them out there beyond the game. So it gets them caught in this trap where they're able to just keep playing and playing because that seems to be the best option for the time being. All right, so I want to give you a little bit of a sense here, but what happens when you're trying to quit? There's some behavioral things that you want to be considered about, ways that you can kind of gauge what is this going to look like if you do try to quit. Based on all that I just presented, there are some things that you need to be keeping in mind so you can measure how well this is going. So the behavioral timeline, and this is more general, it's not going to be strict, adherence, but after about 12 hours of quitting, you're going to see with your kids increased anxiety. And that's where you see that release of, well, you're not going to see the release of hormone cortisol, but there will be a higher release of cortisol. So if it seems if there's a lot more agitation, a lot more anxiety, that's a normal part of quitting something that they've been having much more of a dependence on. What studies have shown is after 24 hours of staying away from screens, users experience an increase in FOMO, or fear of missing out, or social comparisons. We also see physiologically there's increased heart rate and increased blood pressure. So the further you're away from your phone, the more you keep wondering what's going on out there. What are people doing? What are they liking? What are they not liking? So you might see a lot more of begging for it to get back on the phone or to get back on Instagram or Snapchat, just because people don't know your kids don't know what's going on, and it's starting to cause a little bit more anxiety for them. We go a little further out, after 3 days, they may experience what's called phantom ringing, and maybe any of you have experienced this as well. But regularly checking your phone, you could have swore that the text message went off, so you pick up your phone and check it. That's called phantom ringing. But the good news is after 3 days or so is when you actually start to recognize rewards from your family and friends and from your interactions with them. So even though you're getting a little phantom ringing, what's going on here? You're also starting to see that there's positives that come from being with people, being with your family, being with your friends, recognizing that there's a good thing that comes as a result of interacting. You also see what the term is phubbing. If you don't know what that is, it's snubbing your loved ones in favor of your phone. So there's decreased levels of phubbing. So your kids will actually choose to be with you more than they will being on their devices. And also there's been studies that have shown that your attention and your focus do improve as well. So yeah, give or take a few days of trying to see getting past the initial hurdle is usually a good indicator. But depending on how long this has been going on, how difficult this can be, it may be much longer than that before you start to see any prolonged change. It could be several weeks, it could be several months. It just depends on how long this has been happening. All right, so this is part 2. Hopefully I'm not throwing too much information your way, but let me give you guys some ideas and some strategies of what you're supposed to do about this. All right, so we're going to look at this from a number of different ways. So there's some practical strategies that will help to shift away from screen use. And then there's also going to be some ways that we're going to talk about how to manage emotional dysregulation and transitioning. So if anybody who has issues with things like power struggles or arguments, or you kind of anticipate how badly things are going to go when you try to take your device away from your kids, we're going to address that as well. And then we're also going to talk about just some general strategies and ways to manage behaviors and improve communication overall around screen use. All right, so breaking this down, in the first category here of practical strategies, let's talk about advance notice. So you never want to just take a device away. You never want to just pull the plug or cut something off. It makes transitioning much more difficult. you're more likely to get a lot more arguing, a lot more challenges. So what I would really encourage everyone to do is to be prepared. Don't wait until it's time to turn off the TV or the device to figure out what you're going to do to make the transition work. I would love for all of you to have a plan. What are your goals in transitioning? What is it you're hoping to accomplish? Is there something that they need to get themselves to go do that you want to prepare them for? If it's homework, if it's leaving the house, if it's an appointment, right at the moment, not the time to do that. But if you give them advanced warnings, like the second one says, 5 minutes, 10 minutes, and make sure they're clear about what they're transitioning to. In 10 minutes, we're going to be turning this off and we're going to be going to your appointment. You have soccer practice in 20 minutes. So I'm going to give you another warning in 10 minutes. You should be winding down, giving them a sense of what it's supposed to look like as they wind down. If you ever remember taking the standardized test in school and they tell you, 30 minutes left, you should be on problem number 30 at this point. It gives you a little bit of a visual to be able to know what's the best way to gauge your time and how to speed things up or slow things down or not start a new level on some game that they might be playing. Now, for younger kids, or even just for anybody really, but don't just give time indicators. You don't want to just tell them it's time to stop. You want to use cues in the video game to help measure time. And what I mean by that is don't just say necessarily 5 more minutes. It might be a meaningless indicator, especially if they're having a hard time with that prefrontal cortex, knowing exactly what 5 minutes really looks like. Give them something to measure it by. So for example, we're done when this video is over. That can be much clearer. When you get to the next level of your game, that's when you're shutting this off. When you can check 2 more posts and then we're done. So use those kinds of indicators to kind of help your kids understand a little bit more. It reduces arguing. It makes it a lot easier. You don't want to be debating back and forth about what 5 more minutes really looked like. In their mind, they don't have a good sense of the clock. And so they're going to think that an hour is 5 minutes. And when 5 minutes is 5 minutes. All right, so the next stage of practical parenting strategies here is the transition itself. So what happens as the phone or the device or the screens are being shut down or taken off? As we were just talking about this, sometimes your child's sense of perspective is limited. And like we're saying, they need to be reminded with advanced warning when the next time is that they can use it. You may get a lot of blowback in terms of this is so unfair. I don't get to use this very often. Why can't I play more? Part of the transition is to kind of let them know that more is coming. It's contingent on how well they cooperate in getting off of it. And that's near the bottom here, but we'll talk about that in a second. But remind them of the next time that they're going to get to use it. Yes, we're done now, but you'll be able to use it again tomorrow, at the same time. You also want to create what's called screen-free zones. So I really like the idea of making bedrooms screen-free or kitchen tables, during meal times, no screens, nothing like that. If you go outside, you can't use a device. So making it pretty clear about where screen-free zones are in your house could be helpful. As you transition your child off of a device, letting them know where they can go. You can't go to the living room because that's where the TV is. But go to your bedroom, go find a game, go outside and play. Places where you have designated there are going to be no devices for them to turn to. What this also does is, let's say you have multiple children with different kinds of rules that are involved for screens. Having a screen-free zone will actually help avoid the exposure to their siblings who might have a different screen privilege than them. It avoids a little bit of the that's not fair, or having maybe the other sibling rub it in their face that they still get to use their screens, depending on what your kids are all about. You also might want to try to find a preferred buffer activity. So using a more enjoyable activity to transition to rather than directly into a less desirable chore. You don't necessarily have to say, get off your screens, you're going to go do the dishes. Most teens don't want to have to do that. You're going to get more pushback. But if there's something that's more enjoyable for them to do, something that they prefer that is actually screen-free, that allows them to kind of reacclimate to what's expected in the household, it's okay to let them go do that first and then go to the things that maybe you're pressing more for. And always reinforce positive compliance. Arguments are really common when it comes to getting off the screens. Let your teen know how much you appreciate their respect for your request and praise the good choices they make. You always want to catch them being good, even if you're in the midst of something that feels a little bit more disruptive, a little bit more argumentative. If you see that they made an effort to try to do something better, let them know. And it's going to be really important that you keep, as we like to call, your rational brain at your side. You have to be clear-minded. The more angry and upset that you get, the more difficult it is to see the good in what your kid is trying to do to get off the screen and listen to you. But if you praise it, that reinforces good, positive choices. It makes them more likely to want to do it again for you down the line, and you can build off of it. All right, so the structure, we want to create an overall here. It's not just about these particular times. When I was referring to things like you want to remind them of the next time that they can use their screens, create routines, create structure. So a family overall operates best on routines and helps know when screen time is supposed to be scheduled. If it's a random opportunity, it's not going to be easier on you. If you know that every day after school, screens are allowed for an hour, once homework is done or once particular chores are completed, that's a lot more predictable. If it's random, you might get your kids asking you constantly when the next time is. There's a term called intermittent reinforcement. So if something is, these are the old studies that if, they used to have like the chickens pecking for a kernel of corn. And if it pecked and it got a kernel of corn every single time, it didn't really reinforce a behavior. But if they got the kernel of corn randomly, they kept pecking. They didn't know when the positive reward was coming. If your kids don't know when the reward of a screen is coming, they will constantly ask. So have a scheduled predictability. You want that every single time they know 3 o'clock, 3:30, or only on these certain days, or only on weekends from this time to this time. It makes it easier for them to be able to be predictable, and maybe it helps them to stop asking you so often because it can be noticed when they can look forward to it. Like I was saying earlier, keeping devices out of bedrooms or requiring your children, your teens to turn in devices before bed, roughly an hour before bed, is I think is always well advised. And if necessary, you can always go to some certain apps. If you don't trust your ability to kind of gauge time, you need a little bit of an extra help. There are some really good apps out there that do help you to regulate screen use, time, let you know more of a measured sense about how long they were on screens, what they were doing on screens. So Apple's got a good device, a good app called Apple Screen Time. There's Google Family Link. And there's another one that I like quite a bit called Screen Zen, which helps to kind of regulate time, and it helps you to shut down the phone when it's time to move on from using it. So you can use these as good devices. Those are even those good visual indicators. When your phone says it's time to be done, it's time to be done. And this is just regarding multitasking. Like I was saying earlier, try to eliminate TV noise during important tasks like homework or studying. Discourage the use of media entertainment, like having their phones out when they're doing important tasks, and encourage unstructured playtime, more creative pursuits, more social cooperation, games, board games, different things like that. Time with friends where they don't have a video game in front of them always helps with them to kind of build a little bit more of that focus and concentration, and just a little more positive self-regard. Teaches some good social skills too. All right, so this is the part I wanted to come back to when I was saying before about 17.3% of parents tend to prefer using their phone over time with their kids. So this one is targeted mostly at you guys when it comes to being a good role model for desired behavior. It's really difficult for your kids when they notice that you're using your phone more and you're telling them to get off. So it might be important for you to be able to put your phone away as you tell them to get off of their own devices. Your kids are noticing. Your kids and teens, they do feel the negative impact of competing with your use of the phone. I know if there's times where your kids are trying to have a conversation with you and you got your phone out and you're trying to answer an email or respond to a text while you're listening, they know you're not really listening. They know your focus is elsewhere. So it's probably a best thing if you just put your phone in your pocket, put it away. And actually, there was a study done about this where there was a third of children reported feeling unimportant when their parent was on their phone during together time. So for the sake of building positive regard and having good modeling and being able to have better cooperation where it's not, well, you do it, so why should I do it? It's probably best if you find ways to kind of get yourself off of your phone as well, or off of your device. One of the other benefits of this is that positive parent-child relationships, they are predictive in having a protective effect on an adolescent's risk-taking behaviors. So the worse the parent-child relationship is, not able to protect your kids, your teens from taking risky behaviors or doing things that they shouldn't be doing. So the more positive that your relationship is, the better your communication is, the more open you are with each other, the more that has actually translatable effect on, do they make better decisions and better judgment overall. And as far as modeling goes, one of the other things you can do is actually, it's called creating a family media plan. And what this is, it's creating certain rules around technology use. Define the values of using media. What is it? What does it mean to everybody? Why do you all find it important? What is good technology? What is bad technology? You know, good technology could be that you research things together. You explore different kinds of topics or interesting things, and you learn together. Your kids teach you what their games are. You play together. That's good technology. Bad technology is when everybody is isolated and they're on websites they shouldn't be on. They're too involved in their devices. You know, doing homework together, getting help through homework, you know, through screens, not bad. That's actually good technology. And with the websites, I believe there was a presentation on this recently. Watch for the content that your children are watching. There are ways to monitor these things and put blocks on certain websites. So you just always want to make sure that you're aware of those things too. All right, and I know I'm giving you guys a lot of information. I know we're up against time, but if you don't mind, I can go a little bit further, just give you some exposure techniques. This is specifically about how you're going to overcome some of these power struggles that may be happening. So exposure techniques are methods that help you overcome fear and anxiety by exposing you to the feared stimulus. In other words, giving up your device in a safe environment or manner. It helps to control for things like FOMO or just decreasing the phone use in general. So what we do with exposure techniques is we practice. We practice what it's going to look like shutting your phone off. Let's walk through it. Let's turn your phone off right now. How do you feel? You're anxious? Okay, how do we work with your anxiety? So you want to help your child to manage their worries, to recognize what it actually feels like, what the stress is to come off of their phones or to turn a video game off. You practice the techniques that they'll need when the real event actually takes place. It makes it easier to refer back to it. Remember that time that we practiced? Let's try that again. Exposure techniques also help you to anticipate emotional reactions. They'll help you to role play. They'll help you to demonstrate appropriate ways for your kids to react. So if you know you get frustrated every time they bark back at you when they have to get off of their device, an exposure technique not only helps them, but it helps you to know what's the right thing to say. What's the thing I'm supposed to say to you? Well, I understand you're upset, but we need to still do this, versus you yelling at them or versus you arguing with them about why they're being disrespectful. So it gets you the ability to remain calm and have that emotional, rational brain right there. And exposure techniques are just always good to help you for better planning ahead, easier transitions. And like I was saying, to manage your own reactions. So I'm not going to get into all of these, but I will explain them to you. So sometimes with exposure, and we talked about emotional dysregulation or power struggles, how do you help your child in that regard? So there's various methods, various techniques, mindfulness, radical acceptance, directed choices, helping them to identify triggers better that lead to their temptations, what we call thought traps, breathing exercises. It's a lot to get into. I'm going to give you guys an overview, but the more they practice these things, the easier it is for your kids to manage their own dysregulation. Remember, we talked about that anxiety and that stress that comes as a result of the addictive qualities that screens can sometimes have. Once they're able to control for that stress, for that anxiety, for that depression, they can use these various techniques to try to help them to be better, to not be dysregulated, to not be argumentative or vastly upset. But let me give you a little sense of what these things are. So for those who aren't familiar, what is mindfulness? What is radical acceptance? These two work in conjunction with each other, and they go towards something called distress tolerance. We can't get rid of all stress, but we can certainly learn to tolerate it better. We can find ways to become easier about it than being overwhelming or overpowering. So what mindfulness is, that's the first stage. It's a mental state achieved by focusing your awareness on the present moment. You just want to be present. You want to be where you are. Calmly acknowledge your emotions, accept your sensations as they are without any kind of judgment. And you can really practice this anytime. So if I'm, talking to all of you, pay attention to how tightly your shoes are tied right now. Chances are pretty good you probably weren't even thinking about your shoes as we were talking here, but now that I mentioned it, now your focus is there. So mindfulness is a technique to try to just bring your focus away from the agitation of what's going to come next, the stress and worry of how am I going to be without my device. Tell you what, just roll your fingers, just see if you can feel the ridges in your fingerprints. That kind of mindful awareness actually calms the body, calms the mind. And along with mindfulness, you want to do a little bit of deep breathing, a little bit. So you can teach your children, teach your teens how to deep breathe, how to be mindful. If you need a pen or a pencil, you can just hold it. You can feel the tip. You can just play with the end of the pen. All sorts of ways to kind of give your focus, fidgets. These are always good ways to kind of like describe it in your mind. It helps to calm the mind and calm the body. The second part of this is the radical acceptance. Now, what that is, it's not about making an emotion go away. Mindfulness calms you just enough to be able to recognize a situation more objectively. So once you're calmer, you may feel badly, you may feel angry, you may feel disappointed that you can't be on your screens, but you accept it. You understand it's a necessary piece of all of this. So once you're able to kind of take a step back, clear your mind, you can accept, I feel really upset about this. I feel really disappointed. That's a good thing to encourage with your kids. It's okay to feel angry. It's okay to feel disappointed. But you're thinking clear. I'm not debating you on your emotionality. Now that you are clear about what you're feeling, let's come up with a game plan about how we're going to get you to a better transition. So the two of those things working together is sometimes a good way to deal with the emotionality. And certainly the pushback as well. One of the other things I was talking about were thought traps. These are otherwise known as cognitive distortions. You want to try to recognize these kinds of anxiety scripts that your kids might have. To your kids, they might seem logical. The whole idea of that's not fair, or this never goes the way I want, or this is the worst day ever. If your kids say a lot of those kinds of things, those are what we call cognitive distortions or thought traps. To them, they seem logical. They seem rational. But to anybody else, they seem a bit off. They seem askew, and they lead to a lot of problematic coping skills or lack of coping skills, really. So you want to do is you want to try to help your child recognize what these thoughts are, find a more realistic viewpoint. You can download these. There's all sorts of thought traps out there, but some of the more common ones that come with screen use, all or nothing thinking. This is that it's either the best or it's the worst. Hey, maybe there's a shade of gray in there. Maybe there's something that's actually not so bad. It could be bad for you right now, but maybe there's an okayness about this. Catastrophizing, this is the worst day ever. I'll never get to be able to play this again. Kind of making the worst of the situation. So by helping your child to label what that is, helps them to try to figure out maybe it's not the worst thing ever, but maybe it just feels bad right now. Overgeneralizing is this never-ending pattern of defeat based on one example. I never get to stop, use my games when I want to. This always happens. Always and not or nevers are ways that you can kind of see there's a sign of overgeneralizing. Emotional reasoning is when they pay attention to their feelings. I feel this, therefore it's the truth. I feel upset, therefore this thing that I'm in front of me is upsetting. Necessarily, if you recognize that that's just your emotion, doesn't mean that that's the truth. It just means that you feel a certain way, but there might be some alternative ways to look. And then also the fallacy of fairness. The fallacy of fairness is essentially it's not fair. I never get my way. And you can help your child to point out plenty of times when they probably have gotten their way or things have been fair, things have been balanced between them and their siblings when it comes to screens. And then just approaches to communication. It's important that you're assertive but not aggressive. And if you've ever read The Explosive Child, it actually is one of the best ways of developing a communication structure with your kids. And it talks about being assertive. This is the Ross Green book that I was referring to earlier. It's about how to state your thoughts and state your requests without it becoming debate. Recognizing and acknowledging that your kids may have a disagreement, but that doesn't necessarily change the condition. Aggressiveness is more of trying to impose your will. It's more of the argumentativeness. So as you approach this, you want to be as firm and consistent as you can, but also being as calm and collected as you can. Offer praise and appropriate privileges for positive efforts and shifting away from screens. That's always really important. You get better results from being more positive than you do from being punitive or being negative. And teaching media manners. Help your kids with ways to express frustrations. The radical acceptance concept that we just talked about is accepting that they can be frustrated, but they can also be respectful at the same time. And they can accept rules and they can accept limits, even though they don't feel like necessarily they want to do that, that there's a balance. There's a balance of and. And then the last thing I'll give you guys here is you can see from the chart, help your child just to give them the language to be able to communicate their emotions. When kids are frustrated, when anybody's frustrated, we don't really think clearly. When we're angry, when we're upset, our rational thought doesn't really come to mind. But by putting some sort of different language to our anger, it actually helps to create a different conversation. So as you can see by this chart here, the anger face is the largest one. But what a lot of people don't realize is that anger is actually a secondary emotion. The primary emotions are these smaller ones that are circling around the anger. So when your child feels angry, help them identify that maybe they're feeling frustrated, or maybe they're feeling disappointment, or maybe they're feeling worry or embarrassment or hurt or anxiety. But once you start to identify these other feelings, it opens the door for different ways to talk about them. You can't really talk anger because anger isn't rational. Anger is aggressive. Anger pushes you back, and it also might trigger you to be angry. But if they talk about being frustrated, you can understand that. You certainly can understand disappointment. You can normalize those feelings, and you can help your child to come to more of a rational, more calm way of getting off of their screens. All right, so I know I gave you guys quite a bit of information, and I certainly appreciate your patience through this, and hopefully there's a few things that stuck with you that was helpful. If you do have any concerns or questions, or if you want to reach out for further help or services, here's where you can find me. There's a QR code there for my website. You can reach me by phone, email. Like I said, I am located in Buffalo Grove off of Lake Cook Road and just by Lexington Drive. But also the school has my contact information as well. But that's our presentation. And Christina, I don't know if I know I went a little bit over with time. I appreciate everybody's
that's really thank you so much. We do have some questions that were in chat, so I don't know if you would mind staying with us for just a couple more.
Happy to.
Questions. I will get to this. So one of the questions was, is there an ideal age that a parent should give a phone to a child? Someone has a 13 and 9-year-old who they don't have one now, but they're still asking, and the parent is trying to resist for obviously fear of starting to experience all of these things that you have been talking about.
Understandable. So the psychologist's answer is it depends on your child. There's really not a specific age. I think that you have to trust your kids. And if you don't trust that your kids can stay off of their devices or use them respectfully or follow the rules that are necessary, then maybe they're not ready for the responsibility of a phone. I would say when it gets to the point where you're starting to need to contact them outside of school hours, then maybe you have to reconsider. But if you do get them the phone, I would say that there have to be very specific rules, very specific guidelines that you are allowed to check their phones, their text messages. I think that that's appropriate just to make sure that they're using it appropriately.
And I will add that I have heard, I know there are some samples out there of like family contracts around technology use where it's not only something you talk about, but you can create it in written form and have everyone sign it, outline what consequences for not following the contract are, what potential, like to help you again create that structure and that predictability that Dr. Crane was speaking to. That can be one more thing that can help to add a layer of that structure. So thank you. One of the next questions I had was, what does quitting mean? So is it like zero phone, zero gaming, zero social media? Because I think there's just a question of
Sure.
like, how would one define quitting in this scenario such as this?
I think it's unrealistic to think that we're ever going to be able to completely quit our devices, considering how we need them for various, even just academic tasks. I think that when I use the term quitting, it's referring to significantly diminished use or more appropriate use. We want to just make sure we're staying away from misuse. We want to make sure we're staying away from addictive behaviors. So quitting is really more of an essential, yes, likely still using it, but using it in shorter time frames. Being able to put it down without the emotional dysregulation that comes, those 6 key elements that we talked about earlier at the very beginning, making sure there's no change in relationships, no change in emotions. That would be better as far as what we look at when we say quitting.
Thank you. The next question we had is it psychologically damaging to a child to be the only one among their peers who does not have a phone and or is not connected to social media?
I think we have to be careful with the term damaging. I think in the way that maybe I'm gathering that you're asking, I don't think it's psychologically damaging, but it does come with certain consequences, if that's a way to say it. If it is one of the ways that your kids are going to connect with their friends and it is going to increase their sense of depression or fears, or their sense truly of being able to miss out on actual plans because they can't connect with their friends, then I would say you need to find a way for them to be able to communicate with their friends. So that might be where phones or contacting them has to be done in very limited, specific ways. But as far as causing long-term damage, no, not necessarily. It might just be more about how do you help them in more of a healthier sense, along a healthier path to be able to stay connected from a social standpoint with their friends.
Okay. The last question I have is what would be or what should be consequences for not listening to or getting off of the screen that are effective? And I think you outlined a number of kind of self-regulation things that would kind of fall to answer that question, but certainly want to defer to you.
I think it's fair to it's an earned privilege to use phones. I think that's what I was saying before about provided they get off their devices appropriately, they earn the privilege to be able to use it again for the future. But I think if it's going to be an argument every time, I've had parents that have just taken the power cords with them to work, that they make it impossible for their kids to use the device at all, for the game systems or whatever it would be. So I think it's appropriate that it's something that kids have to earn, that they prove that they're responsible enough to use it and to get off of it in the way that you deem fit.
I will add another little creative methodology. And Costco sells little safes that you can, as do Walmart and any other place. But another kind of just way about it is it gets parked in the safe. You don't have to hide it and play the shell game of where did I hide the cords, where did I hide the PS4 controller, where did I hide the phone. It just goes in the bank, like it's going. It's on lockdown. And that helps you. And then again, if that's part of your contract or media contract, whatever, not that you have to go out to get a safe to do that, but I just find it just took the argument away and I didn't have to play the guessing game of where did I hide the stuff. So
good way to do it too.
Multiple children, that can be compounded. So they have small safes and big safes. But in any case, I do want to thank everyone for being here tonight. And I thank you very much, Dr. Crane, for being here with us. Dr. Grzanek is recording this whole thing, so she will be posting it, so you will have access to all of the slides that Dr. Crane presented, as well as our discussion tonight. And again, as Dr. Crane said, you know, he obviously is more than willing to be a resource for you as well. And don't forget your student support teams, the social worker on your team or psychologist on your team. We work together with our community partners quite closely and would be happy to try to guide and assist you in any way. So does anyone have any further questions before we sign off for the night? I'm not seeing anything right now. So, okay. Well, if there are no further questions, oh, perfect. So, we are just getting thank yous.
Thank you,
So,
everyone.
yes.
Pleasure speaking with you. Thank you for having me.
It is truly our pleasure, and I hope that you will consider additional presentations that we have. I know Dr. Grzanek is trying to record them all because we know people have very busy schedules. So even if you have not been to former ones, you can go and look back on our parent section of D125. I know she has information there. And again, I just want to thank you all and wish you a wonderful evening. Okay, I stopped the recording. Thank you. Okay. Oops, let me stop it.